Fantastic. Thank you all so much for coming. I'd like to introduce myself. I'm William Walter, the founder and chairman of Comment Central, a leading comment platform that has the views and perspectives of policymakers. And I am also the founder and managing director of an excellent PR and public affairs that happens to specialise in the adult social care sector. So check it out. So firstly, thanks so much everybody for joining us today. We're here to talk about some of the key issues facing the adult social care sector, notably the state of the CQC, the rise in the national insurance employer contributions and the effect that's having, a soaring demand for adult social care services, underfunding that's affecting the issue, that's affecting the industry, and overall to ask the key question, which is how can we defuse the care crisis time bomb? I'd like to, what I'll do is I'll briefly introduce our three panellists, and then I'll ask each of them to talk briefly about their current work and their current focus, and then we'll begin with the questions. So, firstly, I'd like to introduce Damian Green, who the former Deputy Prime Minister and the current chair of the Social Care Foundation. Damian served as the Conservative MP for Ashford from 1997 to 2024. During his tenure, he held several senior government positions, including First Secretary of State, the Deputy Prime Minister, Secretary of State for Work and Pensions, and Minister for Policing and Immigration. Next to him is Anna Dixon, elected as Labour MP for Shipley in July 2024. Anna Dixon brings extensive experience in health policy. She previously served as Chief Executive of the Centre for Ageing Better and chaired the Archbishop's Commission on Reimagining Care. And last but not least, Mr. Stafford, Greg Stafford, who's a member of the Health and Social Care Select Committee. Greg has been the MP for Farnham and Borden since July 2024. Before entering Parliament, he held leadership roles in local government and worked in healthcare policy, including as Director of the Policy and Engagement for NHS England's Getting It Right First Time programme. Starting off with Damian. Damian, can you just give us a brief overview of your recent work with the chair of the Social Care Foundation, as well as some of the work you've done in the area, particularly surrounding the fixing the care crisis paper that you wrote?
The Social Care Foundation is a relatively new think tank designed to improve thinking about social care. The clue is here on the tin. And particularly in the light of the setting up of the Casey Commission, which I think everyone in the sector broadly welcomes, but everyone equally says 3 years, really, particularly the first year, 1 year to think what the problems are. I think we know what the problems are in the care sector. And so I would hope that Louise, who is a very good thing, will be able to proceed faster than the timetable that she's been set. Will kindly mentioned some of my thoughts on the subject, which are now sort of 5 years old. Basically, we all, in a sense, we do all know what the problems are. There's a staffing problem. There's how do you create a stable and better paid workforce. There is the problem of a lack of integration with the NHS. The integrated care boards, if I'm being polite, I would say have had a patchy effect on actually integrating care more with the rest of the health system. I think we're nothing like far enough down that road. And there's a third area that I would broadly class as prevention of requiring people to need as much care, and in particular keeping them out of residential care for as long as possible, which comes under two subheadings, one of which is the use of tech in the home to allow people to lead as normal a life as possible in their homes, whereas now we just shovel them into residential care too quickly. And secondly, actually housing policy, where we build a tenth as much housing with care, or we want to call it retirement specialist housing, as they do in countries like New Zealand and Australia. And if we built more of that, then more people would be able to live in their own homes for longer, and that would be hugely beneficial to them, and also, as it happens, hugely beneficial to the taxpayer. So it ought to be a no-brainer. This should be driven through by the Treasury, and never has been. But the root of all of those, of course, is money. That there's not enough money in the system. How you get money into the system has been the reason why politicians of all parties have not yet grasped this nettle, despite the fact we've seen this coming for 30 years. You can see demographic pressures growing for decades out, and even though we can see it happening, we haven't done anything effective about it yet. And the reason is because the public is not prepared to think, here is something else I'm going to have to pay for. And either we're going to have to pay for it out of general taxation, or what I suggested in the CPS paper I wrote about 5 years ago now, that we should have an insurance system, savings basically as you do for pensions, or buying an insurance premium, perhaps out of a bit of your housing wealth. If you're a boomer like me, benefited from 30 years of rising house prices just through the merit of living in one, then there are ways you could get money in. But I appreciate that all of these involve taking money out of people's pockets that they would prefer to spend on themselves. It's therefore a tough decision for politicians to make, and politicians have not made that decision. One final point on that: the reason why I would favour much more, if you like, private input, buy your own insurance policy so you can buy your own peace of mind, rather than just saying we're foisting it on the general taxpayer, is that, as I say again, my generation, those who are in their 60s and 70s, have 2/3 of them have benefited from 30 years of rising house prices. If we do it on general taxation, then by and large it will be my children's generation, who are already struggling with student loans and indeed general cost of living issues, who will pay not only for their own care when they come to need it in 30 or 40 years' time, but also for my generation's care now. And I just think that's unfair. I think that breaks any kind of contract between the generations. So I think actually sort of girding our loins and saying we are going to have to be responsible, among other things, just as we say for pensions, to saving for the possibility of expensive care in old age, is, I think, something that we need to confront as part of the general debate.
Fantastic. Thank you very much. And Anna, if I could ask you to perhaps respond to some of those points, but also, if you like to, but also if you could tell us more about your work with the APPG on carers and the current focuses of your work.
Great, thank you. And I'm going to try and see if this is working. I think only if I hold it very close. So good morning, everybody. It's great to be here talking about something that I have a great passion for before getting elected, and I'm continuing that in my role in Parliament. As has been mentioned, this is something that I've most recently spent a lot of time thinking about as chair of the Archbishop's Commission on Reimagining Care, and that was very much focused on trying to, I suppose, break the cycle that Damian has painted there, really, of decades of inaction. So when I first started my career in health and social care, the Royal Commission in the 1990s had reported. Obviously, I then, worked at the King's Fund through the Dilnot Review. So we've had quite a lot of goes at this, and as has government in various guises. But unfortunately, we're still in a position where we have an extremely heavily means-tested system of care. We have increasing numbers and complexity of working age adults, and because of local authority cuts to budgets, that's actually meant that the number of particularly older people receiving support has declined. I'm sure Simon will correct me, but I think about 400,000 people, so-called estimated, are waiting for care. Large numbers. And most local authorities have had to concentrate their care onto the most needy. And as a result of that, it's families and unpaid carers who are picking up the slack. Which brings me to one of the other things that I'm really pursuing in Parliament as the chair of the All-Party Parliamentary Group for Carers, working with Carers UK. And for me, whatever we do in terms of changes to state-funded social care, which I believe we do need to rebalance the roles and responsibilities of the state, what's provided, what citizens are expected to provide for themselves, what communities are doing. But at the heart of this will always be the need to support family carers in the role that they play. So I think estimates are that the economic value of carers is some £184 billion. That's equivalent effectively to the cost of the NHS. There are 1.5 million unpaid carers who are providing over 50 hours of care every week. This is a full-time job for quite a lot of people. And so I've been campaigning in Parliament. I'm very pleased that the earnings limit for carers was increased, which brought a lot of people into being eligible for carers allowance who weren't previously. But there's clearly a lot more we need to do, whether that's in the NHS 10-year plan to support carers with their own health needs, and to go further in supporting unpaid family carers to continue with work. There's been some good progress in terms of employment rights bill, giving day one rights, which will help particularly around flexibility for carers. So that's something that I'm focusing on. And of course, as well, looking to feed into the Casey review, which has been mentioned. I think it's really clear that the government have already taken action to start to stabilise things in the short term. The spending review will be key, providing some longer term financial stability for local authorities. I think that's absolutely critical to the future of social care in this country. Alongside the fair pay agreement, we need to be talking there about fair costs of care for providers, but also a fair resource allocation for local authorities. I think it's right that it's cross-party. I think we've found, too many times, Damian has sort of experienced this. Social care reform has sort of floundered on the sort of political campaign, whether that was the dementia tax or before that with Andy Burnham and the so-called death tax. So we have to prepare the ground. We have to prepare the public. And the only way I think we can do that is to set out a vision for the amazing difference that good care and support makes, both to individuals but also to our wider society. So that was part of the Archbishop's Commission. It's part of what I continue to do in Parliament, is to make the case of the transforming effect of good care and support for individuals, for families, for communities and for society. I think if we get that right, then the questions of money need to follow. I think the problem of the past is that the question of money was the first question, and I don't think it should be in the future.
Thank you. And last, Greg, if you could tell us a bit more about your current work, your recent work with the Health and Social Care Select Committee.
Sure, yes. So that's not really working either. I'll project. Yes, so my background, as you've alluded to, is very much in the healthcare space, but health and social care, as so many politicians always say, are wrapped up together. But unfortunately, the rhetoric rarely meets and matches up with the reality, as I'm sure you're all aware. And I know that perhaps in terms of the way we'd want to project and talk about social care might not start with the money, but the reality is, if we don't talk about how we're going to fund health and social care, and I do include health and health in this, then we are not going to be able to have an effective and honest discussion with the public about how care is delivered. I mean, we have an ageing population, as we're all aware, with increasingly complex health needs. We have a diminishing birth rate, i.e. the people who are going to pay for this, and whether they pay for it now, Damian, or whether they pay for it in 30 years' time, they will be the people paying for it. And I don't think any politician of any colour thus far is having that honest conversation with the public about how we're going to fund, deliver health and social care going forward. And there is a debate whether it's general taxation, whether it's an insurance model, whether it's some other model. I'm not wedded to any particular viewpoint, but I think unless we have these serious conversations with the public, then we can't make the political headway that we absolutely need to in order to solve this problem. I'm on, as you mentioned, on the Health and Social Care Committee. We are about to publish a report on the cost of inaction, i.e. not doing things for social care. Obviously that's embargoed at the moment, so I can't give you detail, but you will be unsurprised to know that that report essentially says that we've got to do something pretty damn quick, otherwise we're really going to have a major problem. And it's interesting that actually when we had Andrew Dilnot in front of us, we'd had the assumption, I think it was an assumption raised now, I think it's an assumption that most people have, that if you spend more in social care, you save money in healthcare. Well, I have to say Andrew Dilnot said that's absolutely not true, because the massive increase that we're going to have to spend in social care means that we are just going to have to spend more money. And I think, again, that's a difficult conversation to have with the public, but it's a conversation we're going to have, otherwise we're not going to have a sensible discussion. Just one final point. If we as politicians are serious about this issue, we can't keep kicking it into the long grass. And I have a lot of respect for Baroness Casey. Spoke to her yesterday afternoon with my Health and Social Care Committee hat on. But we politicians are just kicking this into the long grass for another 3 years. The Dilnot review passed and got royal assent twice, and still isn't law. You know, we can't do, whether we are Conservatives, as we tried to do in the short run up to the 2017 election, or what will eventually happen if Casey reports in 2028-29, the short run up to the next general election, is try and sell this policy, or policy of social care, and how you fund it, within weeks or even a year of a general election. This is something we need to be deciding now. It needs to be cross-party, and we need 3 or 4 years to get the public to understand what it means for them, why it benefits them, and why it may be short-term pain in terms of financial cost, but it's a long-term gain for them financially, and of course, more importantly, socially.
Damian, picking up on Greg's point, Greg's argument is that actually the solution to the social care sector is inextricably linked to the health service. So this, the policy, the suggestion of having an insurance-style model, would you agree that that should also extend to the health service?
No, because I mean, even if I thought it was a good idea, and I suspect introducing it would involve 10 years of chaos and difficulties, I think, as has been observed, I think originally by Nigel Lawson, the NHS is a religion in this country, and to say we're going to change the system is politically impossible. And I observe Nigel Farage trying to scuttle away from everything he's ever said about that in the past. But I think you need to disaggregate the funding and the operation. When I talk about better integration, what I mean is fairly simple things like every year the health service knows it's going to need more beds in hospitals in the winter. And so every year, though I understand not last year for some reason, it makes sure at a local level with local care providers, asks how many beds are available and can you make these many beds available so that you don't have these terrible blockages. Now, the system does not work in that at any one time, something like 7% of the people in hospital don't need to be in hospital, are having a worse quality of life because they're in hospital, as well as being called bed blockers. And the reason is either we haven't got enough spaces in residential care, or more often, and we often forget this, far more people get care in their own homes, get domiciliary care in the jargon, than need residential care. And actually, we haven't got enough care workers in that sector. If we had more people, you could discharge more people into their homes, and the hospital system would work better. So that's, I think, the kind of integration that has not been happening. And really isn't very difficult and ought to happen. Whereas funding, I think one of the most dangerous phrases, and I like a lot of what West Streeting is saying about it, because I can be relatively non-partisan about this. I'm running a think tank which has deliberately got people on it from all parties and none. But I do think the phrase the National Care Service is a dangerous phrase, because you say that to the British public and what they will assume is that, oh, I see, social care is going to get like the NHS, it's going to be free at the point of use. And it's all very well saying, you know, we don't want to start with money, but you end with money. And if you said you are going to put all the costs of care, which currently are a weird mix that nobody understands of private provision and public provision, all of that is going to go into taxpayer-funded provision, as the NHS is, then the system will go bust and the country will go broke. We can't afford that as a country. And so I think it is quite important to say that the funding needs to be discussed sort of discreetly, whereas the actual operation of care absolutely needs to be much better integrated and sort of person-focused. Because if you're an individual, you might drift into and out of the NHS and into and out of the care system, but the system should be dealing with you and not saying that's health, that's care, therefore, you know, the two don't talk to each other, which is at a basic level what happens too much now.
So, Anna, can I ask you to pick up on that point? So, firstly, we'll say two questions. So, one is, firstly, in response to the point that Damian made about, you know, ultimately this is about money largely, that it starts with money. He made it that it ends with money, but it also does start with money, doesn't it? And then secondly, if you could talk briefly about the role of unpaid carers and the role that they can play in helping to fix the time bomb crisis.
Yeah, thank you. There's a couple of points I'd like to pick up as well from Greg's comments. So I think when I say it shouldn't start with money, I think if we think about other important public services, the decisions are within the spending review about how you allocate, whatever money we have as a society to different priorities. And I think we need to, and agree on this point with Greg, take the public on a journey where they value adult social care in its own right, actually. And I do agree with Andrew. We need to be careful about only positioning adult social care as some adjunct to the NHS. More than half, I think now, of local authority budgets on adult social care are actually for working age adults. They are not the people who are sort of so-called, ready for medical discharge and in a hospital bed. So I think it's really important that we sort of follow the facts around this and make the case for adult social care in its own right. To be honest, revenue raising, I settled this argument when I was sort of first doing research. It was around healthcare funding, and the argument then, Gordon Brown was the Chancellor, was again that Conservatives and other think tanks were coming up with ideas for the NHS of, we should move to a social insurance model. The question of how we raise revenue is a fiscal question for the Treasury. We need probably, it's more about saying, do we want more of the care that people need to be funded on a collective basis, rather than, as is the case now, that they either don't get care because they can't afford it and it falls on unpaid carers, or that they have to self-fund. And I think if we want to say, and I think Dilnot was right on this, that there are 1 in 10 who have catastrophic care costs, that's unfair that they fall on those individuals and families, and we want to spread it. But then it's a question of, is it wealth taxes, is it some other form of taxation? I think it should be a separate question. So that's why I say let's not start with the money. So I do feel very strongly on that. And then as for the sort of, National Care Service setting sort of false expectations, in the Archbishop's Commission, we actually talked about a National Care Covenant. And I think this really comes to the heart of what we need to do. We do need national standards. People do need to know very clearly what they can expect. At the moment, it's a massive confusion. Anybody who's had a loved one needing care and been a carer, a lot of the work of unpaid carers is navigating, advocating and fighting a system to get what are their rights, even under the Care Act that we have, which is a very good piece of legislation, but frankly, exercising your rights under that is a hard task. So I think it's really important we do set some national standards and expectations. But part of the Casey review will be to have a national conversation. So it's not that we start the conversation in 20 or 28. We will have had the public conversation by 2028. And I think it is right that it is on a cross-party basis, that it's led by somebody independent, and I think that is what we have to do. But it's not to say we won't be taking action. There's plenty of action that needs to be taken and will be taken before 2028.
Greg, what are your thoughts? On that?
Yeah, I mean,
Yeah.
I think what concerns me is the rhetoric. The rhetoric is all fine, and I don't put any kind of, I'm not making a party political point here, because the rhetoric from politicians forever has been, we need to value social care, we need to make the workforce more appreciated, we need to make sure there's more joined up integration between health and social care. And the reality is, it's never happened. And what worries me is that it's still not happening and it's not going to happen. And this is not a criticism of Baroness Casey herself, or in even her report whenever it is published. But if you look at where the money is being spent in health and social care in this country, it is being spent 99% on the health service, and most of that on the acute health service. And I understand why that is, because hospitals and procedures are big and expensive. And let's be frank, there's a political imperative when the newspapers or the media run a story about waiting lists or ambulances or beds in corridors. That is where the politicians get upset and funnel the money. But if we are serious about social care, if we are serious about joining up health and social care, we have to put the money where our mouths are. And again, when you look at the Chancellor's budget this time round, again, the rhetoric is we want care closer to home, we want social care to be built up, but all the taxation, especially national insurance contributions, of course, the NHS is exempt from that, quite rightly, but the care sector is not. So we talk about wanting to build up the care sector, but everything we do, whether it's just through what we spend our money on, to how we raise taxes, actually does not match what we say. And so all I'm really saying is that we must have that conversation. I'm relatively agnostic about how we fund this, whether it's through general taxation or some kind of insurance model for care. But the way we fund it has to start happening, or proper funding for health and social care especially, has to start happening now. It can't start happening in 3 years' time. It can't start happening in 5 years' time. It has to start now. And politicians need to make the tough decisions now just to build up the workforce.
I think we are. I mean, there's 600 million grant funding gone in, and the point of the local authority funding is to give a 3-year budget and for that allocation to recognise the change in social care. I think it's beyond that if we move away from local authority funding. But it's very clear that the way we're going to invest in social care, where we're doing it already, is through a proper settlement for local authorities. And our local authority has actually passed through that uplift to its social care providers to cover the NI. Now that is a choice for local authorities around the country. That's the problem, that national government can't compel local authorities in how they uplift the fees. If we have a national care service, we maybe could go further in setting rates that would cover the fair cost of care, but at the moment that's down to individual local authorities. Sorry, I don't want to get into a party political discussion, but I think on the whole, Greg and I think broadly agree. There's been inaction, we all know what the problems are, we need to move ahead to fix this, it doesn't need to wait.
Damien.
Sorry.
Because it's at the heart of it. One of the radical changes, I'm conscious we've been talking about problems rather than solutions. I think long term funding it through local authorities is impossible.
Yeah,
I think some local authorities will pass through, some won't, and there may well be representatives of providers in the room who could give you stories of how they are not being compensated for the NI uplift, which itself is very damaging. But I think the underlying point is that I have a lot of sympathy with local authorities who are in danger of becoming basically social care providers with a couple of libraries attached. It's not anyone's idea of what local government should be doing. And actually, I think the National Care Covenant was a good idea. I think that's what we need more than labelling it a national care service. That's quite good. But it is a national issue, which therefore should be nationally funded. And that if we do that, We can then have all the political arguments you want to have about how much you should fund and what percentage of money should go to care as opposed to defence, police, anything else. And that is the heart of political debate. But that as long as we try and pretend that it's going to be funded by local authorities, then we will underfund care and simultaneously damage local authorities and their reputation. And both of those are bad things. So let's stop doing that as a first change.